for nasotracheal suctioning. So we're going to check the patient's chart, make sure the order is in place. We're going to get our supplies. That would include we want to make sure the suctioning is set up in the room, the patient has oxygen available in the room, and then we have our sterile suctioning kit that we take with us. So we'll head to the patient's room. Hello, Mr. Blank. My name is Trisha and I'm with Respiratory Care. So today we're going to do some suctioning through your nose. I see you have that nasal airway in place, and we're going to help you remove any secretions. Can I get your name and date of birth? Okay, and then is it okay if I feel your chest for a moment? So when I place my hand on your chest, I feel like you've got some secretions there in your chest, and we're going to help you remove those, okay? So the first thing we're going to do is we're going to go ahead and assess him. We're going to do our vital signs, listen to his breath sounds. Mr. Blank, I'm going to put this on your finger to measure your oxygen level, and we're going to keep that on through the entire process. We want to monitor that. If at any time that begins to drop, we want to stop what we're doing. So the first thing we're going to do, even though your oxygen level is good, we're going to go ahead and give you some oxygen because we want to make sure you're good and oxygenated through this process here. So we'll put some oxygen on. We've assessed the patient, and we're going to go ahead and turn our suctioning on. So with our suctioning, he is an adult, so we're going to do -100 to -120 for him, and then we're going to open our suctioning kit. So we have our sterile kit. We open the kit. We're going to put our sterile gloves on. We're going to try and keep one hand sterile and one hand clean. So this will be my sterile hand. With our suctioning kit, we have lubrication, and then we also have sterile saline that we brought into the room. We're going to add sterile saline to a little cup out of the sterile kit, and then we're going to open our lubrication and either put that on the lid of the sterile kit or in the palm of our hand. Then we're going to remove that catheter, and we're going to go ahead and attach that to the suctioning, and we're going to ensure that it's working. So what we're going to do is we're going to put the tip of the catheter into the sterile saline, occlude the thumb port, and we should notice the sterile saline coming through that catheter. That just ensures that the suctioning is working correctly. And then we're going to lubricate the tip either with our lubrication on the lid of the kit or in the palm of our hand. And then we are going to remove the oxygen. So Mr. Blank, I'm going to remove the oxygen so that we can get going here. Once I put this in through your nose, I'll instruct you to cough at one point if you don't cough, if it doesn't make you cough. So just nice, easy breathing for me. We're not going to occlude the thumb port, and we're going to advance the catheter through the nair. So we're going to go ahead and slowly put that through the nair. Our first resistance. Okay, Mr. Blank, go ahead and cough for me. That goes through the vocal cords. Then we're going to continue to advance a lot more. Second resistance is going to be the carina. At that point, we're going to pull back slowly and occlude the thumb port. We're going to start twisting that cannula. So as we're twisting the cannula, pulling back, the thumb port's occluded, removing those secretions. The suction piece should last less than 10 seconds. The entire process should be about less than 15 seconds. So we've pulled this back. We are finished. I'm going to let go of that thumb port. And then Mr. Blank, I'm going to go ahead and feel your chest again just to make sure we've removed all of those secretions. And I do not feel those secretions there, so we have completed that. We will get rid of our supplies. Go ahead and put the oxygen back on the patient. All right, Mr. Blank, then I'm going to look at your vital signs again. So then we are going to listen to the lung sounds, get those vital signs. Oxygenation has stayed well throughout the process. Hyperoxygenation, or oxygenate the patient for at least a minute afterwards. Then we are going to remove the oxygen, make sure the suctioning is turned off. We're going to answer any questions Mr. Blank may have, make sure he's comfortable at this point, it doesn't need anything, and then we will go document what we've completed.